All right, we're going to put this up high so you folks can see what I'm doing. All righty? All right, most of the time patients will be found, that's right, waking up in the morning. So the first thing that I do for my patient as they're waking up in the morning, I might be going in and giving a breathing treatment. I might be coming in here and taking off their equipment, getting ready for a breathing treatment. The thing that I always do is also bring a nice, wet, cool washcloth and put it over their eyes. Remember, those eyes need to be lubricated. Eye drops, and because he might be using his eyes for communication. You know, this bed is way up high, so I know your beds aren't this high at home. But so I'm going to bring it down I'm going to bring the bed down just a little bit so I can start doing some range of motion. If your patient tries to get out of bed, first thing in the morning, we're going to be very stiff. And so starting with right down here at the hands, I'm going to be doing range of motion with the hands. There is a hand massage on my video, or if you go to my website, you'll see a hand massage, which is very easy to do. But also, we are going to be doing this kind of exercise. And we're also going to be doing these kind of exercise. Now let me tell you, if you're a patient and you've been in a wheelchair for an extended period of time, the body wants to do this. They want to become adducted. That means like this, all right? And I don't have anybody here that I need to correct because you're all sitting in some pretty nice chairs that you have been able to secure. But when you're sitting in an abducted position like this, these shoulders can get locked. Even some patients right now that are in wheelchairs, if I try to raise your arm, you might tell me that you're having a lot of pain right back here. And what I call that bone back there is your angel wings right back here. They get very tight. And so being able to do range of motion like this and being able to spread it across. I'm taking your name tag off.
It's a magnet.
Oh, it's a magnet. Oh, I get to go underneath, huh? Woohoo. Woohoo. And going across. Oh boy, you're going to be stretched out good.
Yeah.
All right. The same goes for your legs. You're going to be doing a range of motion with those toes. And you know what? If you're in that wheelchair all day long, your legs might be elevated at nighttime just so that the blood can go back up, all right? Because your circulation might be a little bit slower. And that's all part of it. I also have patients who tell me, even as young as they are, they might say, oh, my feet look like they're purple, you know, and they're really cold. That is also a circulation issue. It might be something that your doctor might want you to wear some pieces of equipment on your legs here that will pump your blood back. I think anybody that's gone through it, any kind of surgery, knows those boots that doctors will prescribe. But that's totally up to your doctor. It might not be necessary. Like, I like to just make sure that I have them. Don't do it for me. All right, we're going to bend it up. Okay? This is what we're doing. We're bending them up and we're flexing. Flexing. Okay? We can also do the circles. Another exercise that a lot of patients like to do, I know there's a few of them, if you take your hand, this part of your hand, and you put it right on that heel, and that foot can go there, and you hold this straight, you ask them to push down on your hand, okay?
This hand?
Yeah, push down on my hand. Go ahead. Keep pushing. Keep pushing. Where do you feel that the most? Where you should be feeling it the most is there, and you're also using your abdominal muscles. So when you do this, and you're using those abdominal muscles, those are the same muscles you use when you sit on the toilet and you're bearing down. So let's get those muscles a little bit tense and ready to go to the bathroom if that's the time of day that you're going to do it. So I'm going to get you all stretched out a little bit. I'm not going to do the whole shebang, but when do you like to do these, Mary? I like to do them first thing in the morning, and I like to do them at bedtime. If I'm getting a guy ready to start his day, maybe getting into his bed and being after a shower and getting towel dried and getting everything on, and then getting ready to get dressed. Let me see. Okay. I'm kind of going through these because I want to get to everything. All right, so I want to show some positions of comfort at bedtime. I can't make him comfortable. He says nothing's good. So if you take a regular sheet and you put it here, or you can buy those pads, then you have what is known as a draw sheet. I'm just going to use this top sheet as that, okay? Everybody know what a draw sheet or that pad that goes underneath their bottom is when I talk about? And the best place to put it is from the shoulder to just below the groin area, because this is where the most weight is. So if I want to make him comfortable at night, I think it's better for everybody to see if I'm on this side. I want to turn you to this side. So if I'm by myself and I want to do that, now, you're my patient. You can't do that, remember? Okay, there we go.
Okay, nurse.
Nurse, right. Okay, so then I take this and pulling you over on my side of the bed. What works very well is that if you have a cotton pull sheet and you're on something that's satiny, it's going to pull a lot easier. Or if you have him in basketball shorts, or you have your lady in a nylon gown, they're going to pull over a lot easier. All right. When you want to go to that side, have your pillows ready. If you're going to that side, you cross that leg over. I guess I need to put this one up. When you have turned his leg this way, the hip, which has the heaviest, is going to be right there. So you're going to cross this here, move the elbow out, and you can turn that way. Once he is turned that way, scoot the pillow over. You take another pillow, you put it here. You might need to put one here. And you put him in a nice runner's position. There you go. Two important things once he's over on this side. Check that earlobe, that it's not bent like this. Okay? Very important. Take your hand, go into that shoulder that's wedged into the mattress, and turn him that way. You might even want to have a pillow right here for him, for his hand. Leon, did I leave my my bell up there, my little white bell back there on the stick where my stuff is?
All I need is my clicker.
All you need is your clicker for your TV set. Okay. The other thing that was developed, and there's different ways of calling for their patient. Thank you so much. And I had a patient that told me that this worked the best. This is a $16.95 doorbell. was on a small thing, so he put it on a lollipop stick so that he could grab it easier. And so you would put this here. Okay, so that's here, or you can tape it to the bed, whichever way, so that you're in control. Like I said, you have a doorbell to get somebody that's in the kitchen. This thing is only a range of 100, but it does go up to about 250, so somebody could go out to the garage. The patient I had lived in a big house on the lake, and he had 2 of these. One of them was, I need something. The other one was much louder, and that meant, come right now. So that's how his system worked. One of the other things that I failed to start with is everyone needs to have one of these if you are a caregiver. Again, $17.95 at Ace Hardware. Very nice. It's Velcro. I'm going to put it on right now. And I'm a big believer of this. I don't care how skinny you are. You need to have one of these on because you need to protect your back. My back's in bad shape, and it's from years of not wearing this, so I'm a big believer in wearing this. And it goes on very easily. Goes here to here, one, and then these Velcro straps even get tighter. You're trying to protect your lumbar and your sacrum area. You have about 5 discs in there that really support you on everything. So being able to protect that's very important. All right, so we know, I could turn you to the other side. I think everybody has the idea. Another thing I'm going to get into, which is very important, is, let's see if I can get you back straight. There is, okay. Oh, we got this one behind your back. All righty. Another thing that I do, which is comfortable for patients, because my controls are on the other side, is I do the spread eagle, my little spread eagle position. I think I'm gonna put the bed down here just a little bit. And remember I say sometimes patients, and it's all right if you can get into the bed with the patient. Here's some other exercises that work very well onto your stomach. Because you've been sitting in a wheelchair all day, that lower sacrum is very sore. And so this is a great exercise to do. You do this, and then I say, turn your head that way, and I go like this, and that's a stretch to the lower back. How's that feel? Good. Okay. Being able to have them push down, again on your hands, are great. Another position which I think is good is frog leg. And you know what, folks? This is also a very safe, comfortable position for intimacy. Oh yes, I'm going to talk about that. You know what? Nothing. Hey, yeah. I think everybody should be comfortable. And to be able to do this and be very safe about it is fine. Even if you have your mask on, it's fine. Guess what? It doesn't break. It's there to the very end. And you know what? Go ahead. I think that's really important. Oh, okay. Is that a message to your wife? Yes. Okay, so this position is safe and patients can stay on their breathing apparatus and everything works fine. Now, we're going to transfer you out onto the Hoyer lift. And from the Hoyer lift, we're going to put you on the potty. We're going to talk about some different positions in order to go to the bathroom. Okie doke. I think I'm going to have to work the Hoyer from this side. How many people have Hoyer lifts? A few, okay. There's nothing to be concerned about with Hoyer lifts. And, oh, you want to hear a funny story? Oh, this is a funny story. So I went to see a patient in Houston, very, very attractive black lady, and she was married to Denzel Washington. I'm telling you, he was so good looking. And so I'm doing a history on this lady, and she's sitting there in her wheelchair. And I'm getting the history, and she is about 4 years older than him. And I went, ooh, good for you. And so he's sitting there, and I said, how are things with the Hoyer? Are you folks using your Hoyer correctly? And he said, no, they just delivered it. It's in the garage. We really don't know how to use it that well. And so I said, well, why don't you go outside and get it, and then I'll give you guys the info on how best to use it. So she's walking. He's walking to the back door, and he's going out the back door. And she's standing there, just sitting there watching him. And as soon as he got out the door, she goes, I want you to talk about sex. And this is the first time I'm meeting this couple. I'm like, what? And she says, sex. I want you to talk about sex. And I said, what? Are you saying you're not having sex? And she said, no. And I said, well, why not? He's thinking all hurty. I said, honey, if he's not giving you any, you are hurting. I know that. We're going to get to that subject. Don't you worry. We will address that subject. And I'm sitting there praying, saying to myself, oh, Lord, how am I going to talk about this? So we did a little shower thing, and then I put her in bed, and she was in her clothes, just like you. And I put her in bed, and I said, now, when you're done, you have to put powder on her and get her all. And then I said, and then you have to put her like this. And then you got to get to work on your business here, okay? And the next time I saw her at a support group meeting, she comes rolling in, and here's Denzel bringing her in, you know. And I looked at her and I said, how are things going? And she went. It's like, yes, yes. So folks, listen, that's all part of life. You're living life right now. So that has to be all part of it. As you can see, you know, every time I see one of these, they're always different. So I have to get acquainted with it. This part here is going to be on the back, and these two things are on the legs. But the legs are going to crisscross. So let me show you how we're going to do this. Oh, and another thing. Oh, I got you in bed here. Somebody said to me, if he or she has soiled their bed and we don't have time or don't want to wait till the aide comes in the next day, the fact is that if you pull the patient close, get them on the side, and then you roll up the soiled linens and put the clean linens behind them. I wish I had two sets of different color. It would be able to show off better. Do you follow what I'm saying? Because as long as it is an extra long twin that you're able to secure, then you're okay. All right, we're going to roll you to this side safely. And from here, so that blue line went from the shoulder blade just past the arse there. And we double it up. So that when he comes back this way to me, then we can pull this out the rest of the way. It is centered It is pretty centered. There we go. And because it's of that nylon fabric, it will. And this is how. And this is something that can be done by oneself. This fits underneath. And let me demonstrate this before I do it, because I'm going to have him in the swing, so I don't want him swinging around too bad. This does open up so that you can put him in the Hoyer and then put this around a recliner chair. But it will, at this point, just go under the bed. Make sure this is under your tush. When we're done here, it's going to look a little bit like some Japanese, whatever. I always keep my hand on this. Now this will have its latch right here. Sometimes you can put it on this one. And I think I will put it on the second one rather than the first one. Okay. As it's raised, it's important to stay back here by the head so he's feeling secure. Sometimes patients will use this and immediately put a bedpan down here so the patient can go to the bathroom without being transferred over here. But we're going to transfer him over here just for demonstration purposes. Okay. Face me so I can see your face, and I know that you're okay and you're not in any stressed position right now. I'm going to take this thing out so you don't get that mark on you. Okay. The important thing to remember during this part of it here is protecting the legs. Because I find if I can hold on to the legs, then he can go back easier into the chair. Isn't that right, Brian? Okay. I think the troops have landed. Oh, I guess that's locked. So then what you do is making sure that he's all the way down. And you can keep it on the back, but I like to remove it from the legs. If you're going into a chair that you're uncertain, you might want to put one of the sides down. Feet on the ground. Oops. Okay. These slings are usually washable. Okay. Patience. When you are on the commode, the fact is that our bowels are such, you're doing good, our bowels are such that when we come down, here's our small intestines, transverse, and then it goes down, and then into here, before it gets into the rectum, there's this, the sigmoid. It's kind of in this position. So when we sit down, we're in this position. But sometimes if we lean forward, it's easier for us with our feet on the ground, or maybe even a little stool, for us to use those muscles that we bear down when we were pushing our feet. Am I making myself clear? Good. I wasn't sure. So sometimes I would have a patient, and I don't have it now, but I would have a bedside table, you know, the ones that you put the food on, okay? And they could take the bedside table and just lean forward on that. I had it such that one guy was able to lean on it, and across the front here was the sports section. So he would just lean on here and read the sports section, and when you needed to come in and turn the page, he would say, "I'm almost done," and you knew that the day was done. And the fact is that if you're taking food, but you're not, even your formula through your tube, if you're not taking enough water, or if you're perspiring a lot, you're using up a lot of water, your bowels are going to be dry. If your bowels are dry, make sure that you're using things like Senna or Miralax, or maybe even lactulose, things that are going to help you have normal, smooth bowel movements. And sometimes what happens is down there in that sigmoid, it gets there and it stops. It's like a cork. And everything above it that wants to come out when you're like this is probably smooth and soft and runny. So if you can get the sigmoid to understand, okay, the stool's here, if I can get it to go, but if you can't, that's when perhaps you might need a suppository, like a Ducalox suppository or glycerin suppository. These are all items that are over the counter, so it isn't something that you need to have a prescription for. Does anybody suffer from that? Constipation gets dry and then they have to wait. Okay, I see a few hands. All right, very good, but let me just say, put things into their diet that you know always worked. I had one lady, and she would have her cup of coffee every morning, like clockwork. She got a glycerin suppository, and then we just moved her like that onto here, and she was good to go. Somebody else, you know, we grind up a pear, we put a pear in a lot of water, put it through his tube. Pears worked great. Whatever worked for you before, try it now. You know, mine's sweet potatoes, just as sweet potatoes, and I'm good to go. So again, it's important that you do move your bowels, because what goes in must come out. And the important thing, and I think you might have seen it in that other clip, I'm trying to think if I'm going to use you some more. I don't think so, not right now, if you'd like to go back. All right, very good. Does anybody want me to demonstrate getting him off the floor. Has anybody had getting off the floor problems? Again, we're going to find where the back is, in the middle of where the back is, okay? And maybe your sling's a little different. Just put on the label here, front or back, so you know what you're doing as far as how you're putting it down, okay? Don't you want the pillow on your head, honey? There you go. All right. So, here we go. That's where you fell. You okay? All right, so I'm going to turn him so I can put this on. So what do? We take the leg, the opposite leg, so the hip's already up, and we can roll him to this side. We put this on the heaviest part, which is like the shoulder blades and the tush, okay? And we roll this underneath halfway. All right, here we go. Back over here, and now you can come to me. All right, very good. This is going to hold that leg up. This is going to hold that leg up. Now remember, the Hoyer lift will go all the way down. To the floor. You just have to be careful of what you have here, whether you have pants on or if you need padding, so you don't hurt the family jewels. I'm watching your head. When he's this far up, there are little latches on here where you can pull this up, and he's more in a swing now. Like I said, I like to watch his feet so I know what his face is telling me.
Wow, I know where Orlando.
Yeah, we almost are there. When you're moving, it's better to be closed. You ready? I have a running start here. That down just a tad. Like I said, I like to watch the face so I know that you're not hurting anywhere. Ah! Maybe I should bring that that center bit. Oh, wow. Here we go. Every Hoyer is different. Make sure that you have one and a sling. You might even see if you can have an extra sling. I don't know how big is the loaner closet here, folks? You have a pretty big loaner closet? I'm looking for one of my ASA folks from here.
Is that butterfly sleeve?
Mm-hmm. They also have one that's whole, and then it just has a big hole here. But I don't find that as easy, and you tend to get it messed up more. Okay, Mr. Ron. Let's give our